What do you do if your loved one refuses treatment of any kind and refuses to see their doctor?
So obviously it's a difficult situation. Okay. I think first of all, we all have to respect everyone's wishes and personal wishes. And I understand your loved one, that we all care about them and we want them to get the best help as much as possible. And there are many reasons why someone may refuse to go and seek care, and it can be extremely difficult. What I try to tell families of loved ones who are actually having difficulty getting maybe a relative or someone who has HD or maybe at risk to come to our clinics and seek help is, number one, is give them a little bit of space, time to come to their decisions. Pushing somebody often pushes people away. So that's not really all that helpful in my experience. Of course, that's just personal experience. But so what I'd say is give them a little bit of space, talk to them, give them the time to make that decision. And it does take time sometimes to make that decision to go seek help. You can't necessarily force someone, although if their loved one doesn't really have what we call the capacity to make, good decisions, judgment, insight into what's really going on, that may require a bit more pressing. And it may also call for professional assistance. So bottom line, don't pressure, give them time, give them a bit of space, push, be understanding, ask questions. Why are they reticent to go? And if it's really necessary, ask for professional assistance. As a center, we're here to help you get advice. We have a case manager, talk to other case managers to help you with this decision. And if it does require intervention, especially if it becomes a care and safety issue, okay, if there's some form of neglect going on, they're not caring for themselves, they're on the street or some really unsafe situation, that's where you do need to intervene. Okay.
Hi there. Many times too, and again, it's individual, and as you all know better than I do, each person's journey is their journey, and it's very personal. Oftentimes, it's triggered by past memories and past issues that weren't really addressed because the knowledge wasn't there. So simply saying, you know what, there's a lot of research that helps patients, and you may be one of those patients that may participate in a trial. We use that to instill hope, but also in our clinic, we say, come and visit. You can come and hang out and be part of Enroll HD and test the waters and see if there's a rapport. But always, as Dr. McFarland said, it's a personal choice and time, space, and just hope.
Yeah, I would also add that, as Dr. McFarland said, there are lots of different reasons why somebody may be hesitant to go to the doctor. They may be afraid of the side effects of medications if they've had an uncomfortable side effect in the past. They may not feel comfortable in a medical setting. They might not feel comfortable being around other people who are also sick or are sicker. And so one positive side effect of the last 2.5 years with COVID is the rapid expansion of telehealth access. And so we've found that many patients are more comfortable seeing us more frequently from the comfort of their home over video or even a telephone call. But sometimes the barriers, depending on what someone's hesitance might be coming from, the barriers for a telehealth visit to even just talk about what's going on are much lower than coming into the clinic physically. So you can always ask your center or doctor about that option too.
One of the things that I just wanted to add is going back to the safety issue. If somebody is being unsafe for any reason, the family member is wanting this person to get help because they're participating in unsafe behaviors. They're putting the family at risk, they're putting themselves at risk, anything like that. There are things that you can do to initiate involuntarily having that person evaluate. It's hard. I'm not going to say it's an easy decision to make. As a parent, I've had to make that decision my own to actually go to the courthouse and do an ex parte order. It's something that you can do though. And so a lot of times what happens in situations when people are being unsafe and the police respond to that, the police criteria, and again, I'm speaking primarily in the state of Florida, but all states have similar laws, but the police to involuntarily commit somebody, how they evaluate that and actually involuntarily commit somebody for evaluation is different than what a licensed mental health professional is. And also, it's different than what a judge can order through an ex parte order. So if somebody is constantly putting themselves in an unsafe situation, you can go to your local courthouse and document that information and basically plead to the court that this person is not being safe. And a judge can ex parte them for involuntary commitment. Hard thing to do on an emotional level for somebody that you love and you care about, but sometimes for the safety of the whole family, it's what's necessary.